Assalamu alaikum wa rahmatullah. This is the third lecture for clinical parasitology. We have here discussion about the parasites inducing central nervous system manifestations. Firstly, we'll discuss the parasites causing convulsions. The first is primary amoebic meningoencephalitis accompanied by fever and coma. Then amoebic brain abscess, which also may cause convulsions. Thirdly, African trypanosomiasis due to involvement of the brain. Then acute toxoplasmosis in infants and immunocompromised adults. Cerebral malaria, encephalitozoon halum infection, cerebral cysticercosis, schistosomiasis japonicum. This is the only type of schistosoma reaching the brain. Encephalitozoon halum is one of the microsporidia which replicates in the gray matter of the brain. Rarely inhibited disease may be causing convulsions, also visceral larva migrans, disseminated strongyloidiasis, Angiostrongylas cantonensis or eosinophilic meningitis, other intestinal helminthes like Hymenolipis nana and Ascaris in children, also Lua lua may cause encephalitis and convulsions. Then parasites causing hydrocephalus. Hydrocephalus means that there is a child with an increased intracranial tension due to any cause. The brain and the skull is malleable and may enlarge or expand, so hydrocephalus occurs. It occurs in cases of congenital toxoplasmosis, and it is common cause of hydrocephalus. Secondly, internal hydrocephalus with increased intracranial tension, which occurs in cysticercosis, also may occur in hydatid disease if there is pressure on one of the ventricles. Then parasites causing infection in the brain or causing meningoencephalitis. Protozoal causes are African trypanosomes, Trypanosoma cruzi sometimes, then cerebral malaria, primary amoebic meningoencephalitis caused by Naegleria fowleri, also acute toxoplasmosis in immunocompromised patients. Helminthic causes are disseminated strongyloidiasis and Angiostrongylas cantonensis causing eosinophilic meningitis. Parasites causing coma. The first is cerebral malaria, which is usually of sudden onset accompanied by high-grade fever. Then African trypanosomiasis preceded by gradually increasing symptoms of meningoencephalitis and fever and positive Crandall sign in case of Trypanosoma gambiense. This is not the case in Trypanosoma rhodesiense, where there is progressive symptoms of stupor, dullness, then sleepiness, then coma. This is of rapid course and occurring rapidly, consequently, and this is severe case of Trypanosoma rhodesiense. Then primary amoebic meningoencephalitis. This could be known by or diagnosed by the history of swimming or diving in hot pools. Also, there is positive Kernig's sign. Kernig's sign means that when we raise the head, it doesn't, no flexion occurs, and the head and the vertebral column come up as one piece. Then we'll come to cerebral cysticercosis, especially in Latin America. Serology and CT scan are diagnostic in this case. Lastly, nerve trunk affection. This is in the large nerve trunks and spinal cord. Transverse myelitis of spinal cord is a case occurring in schistosoma mansoni infection. Also, spinal cord compression may occur due to conurus cerebralis, and optic neuritis may be caused by onchocerciasis. Parasites affecting muscles. What are the parasites causing myositis? Myositis means inflammatory reaction of muscle cells with stiffness, limitation of movement, and severe pain. These are trichinosis or Trichinella spiralis, then cysticercosis, also a larva growing in muscle, then acute toxoplasmosis affecting muscles and replicating in muscle cells. These are the three types of parasites causing myositis. Then myocarditis, which is affection of the myocardium, characteristic in Chagas disease. This is the most common cause of myocarditis. Also occurs in Trypanosoma rhodesiense. Also can occur by helminthes like Trichinella spiralis. Again, acute toxoplasmosis in infants and in adults can cause myositis. Now, parasites affecting blood elements. As you see, obviously this lecture I made because I didn't want to leave any possible symptoms caused by parasites not discussed. So I collected what affects the central nervous system, the musculoskeletal system, the blood elements, and other things collectively in this last lecture for clinical parasitology. The parasites affecting blood elements, firstly, the common thing occurs due to parasitic infection is anemia. Anemia is caused by many parasites, either nutritional by suppression of the nutrients and so this causes anemia. It is usually iron deficiency anemia, but there are also and hypoproteinemia كمان. لكن بيبقى كمان عندنا أهم حاجة causing anemia is malarial parasites. Malarial parasites cause anemia, which is not corresponding to the stage of parasitemia. Anemia is more than expected by parasitemia. يعني ممكن نلاقي low parasitemia مفيش مثلا غير few parasitized RBCs، لكن نلاقي الهيموجلوبين مثلا 7، فده ما يجيش أبدا مع ال extent of parasitemia. الكلام ده we discussed it during studying malaria, but I remind you that this occurs due to hemolysis of both infected and uninfected RBCs. You can recollect why this occurs. Secondly, we have Kala-Azar and trypanosomiasis. In case of Kala-Azar, anemia occurs due to low nutrition, firstly. Secondly, because there is encroachment on the hemopoietic elements of bone marrow due to replication of phagocytes, and these become laden with the A mastigotes. Trypanosomiasis anemia occurs due to extensive fever, low nutrition or malnutrition, and also sleepiness of the patients who don't need to have food. Hookworm infection is the second great cause of anemia, because also in hookworm infection there is continuous bleeding from the intestine, iron store depletion, toxins of the worm itself can cause bone marrow suppression. So in case of hookworm infection and malaria, there must be regain of iron store inside the body, so we give iron intensively. Diphyllobothrium latum, less frequently giardiasis, can cause megaloblastic anemia. Also, trichuriasis can cause both iron deficiency or nutritional and megaloblastic anemia in the same time. In chronic sleeping sickness, schistosomiasis, fasciolopsiasis, ascariasis, strongyloidiasis, there is nutritional anemia, either due to continuous diarrhea or due to somewhat bleeding or feeding on tissue fluids by strongyloides مثلا. برضو chronic sleeping sickness, sleepiness and no food, so these all can cause nutritional anemia. The second common phenomena due to blood element affection is eosinophilia. Eosinophilia usually accompanies parasitic disease. It is either moderate eosinophilia from 6 to 20% in case of isosporiasis, trichuris, ascaris, paragonimus, thymias, and eosinophilic meningitis. Some can say, what about hydatid disease? Where can we put this category? It is categorized in the moderate eosinophilia also. High eosinophilia from 20 to 70% occurs in trichinosis, strongyloidiasis due to hyperinfection. Hookworm infection somewhat is less, about 20%. يعني عند اللو ليفل، لكن الفيسرال لارفا مايجرانس عند الهاي ليفل. Filariasis, schistosomiasis, and fasciolopsiasis can occur with high eosinophilia from 30 to 50% in the blood. In case of tropical pulmonary eosinophilia, there is high eosinophilia, may be higher than 70%. It occurs in tropical areas endemic for filariasis. It can occur with Bancroftian and Brugian filariasis, also with Lua Lua, Manzonella, and Dirofilaria infection. Leukocytosis, meaning that there is high leukocytic count, could be with shift to the left، يعني segmented تبقى أكتر، وده في حالة الأميبيك liver abscess. Also, early other parasitic infections as visceral larva migrans, strongyloidiasis, trichinosis. It is usually with high eosinophilia في الحالات دي. لكن في حالة الليفر ابسس بتبقى زي ما قلنا shift to the left، يعني بيبقى السيجمنتد بتبقى اكتر حاجة موجودة في البريفرال بلاد. بعد كده في الشاجس ديزيز برضو بيحصل لوكوسايتوزيس with relative lymphocytosis، وده بيبقى علشان اللي بيحصل ساعتها تكوين الاميون complexes against trypanosoma occurs mainly with lymphocytes, as we know. So there is proliferation of lymphocytes and being abundant in peripheral blood. عكس اللوكوسايتوزيس بقى leukopenia. Leukopenia occurs in Kala-Azar and is the main cause. It is the main cause of parasitic leukopenia, which is due to encroachment on the hemopoietic elements in the bone marrow زي ما قلنا قبل كده، وده بيبقى نتيجة الانفيجن of leishmania to the phagocytes and monocytes and replication of these cells to compete with the amastigotes of Leishmania donovani. In malaria, there is leukopenia with relative monocytosis. برضو نفس الكلام نتيجة proliferation of monocytes and the lymphocytes for antibody formation, so it occurs in chronic malaria. نيجي للريتيكولو endothelial system. Lymphadenitis, this is either generalized or localized lymphadenopathy. Generalized lymphadenopathy occurs in early stage of African trypanosomiasis, early Chagas disease, acute toxoplasmosis, and in visceral leishmaniasis. These are the 4 cases of generalized lymphadenopathy. Also, if we speak about the localized lymphadenopathy, firstly, we'll remember Winterbottom's sign in African trypanosomiasis, where there is multiple bleeding, where there is enlargement of the posterior cervical lymph nodes. Also, posterior cervical lymph nodes may be affected in chronic pediculosis. هنلاقي إنهم هيبقوا ماشيين ورا بعض زي العقد أو زي السبحة، وده عشان كده بنقول multiple beaded lymphadenopathy in chronic scalp pediculosis. There is also inguinal, femoral, axillary, and epitrochlear nodes which are affected in filariasis. أكتر حاجة بتأفكت النودز في الفيلاريسيس هي نوع من الفار إيست filariasis اسمه بروجيا تيموري which can cause abscesses في الانجوينال lymph nodes. لما نتكلم بقى على السبلينوميجالي as a part of generalized reticuloendothelial hyperplasia in Chagas disease, African trypanosomiasis, visceral leishmaniasis, and malaria. Malarial attack causes enlarged tender spleen, sometimes with gradual enlargement of spleen in chronic malaria. Falciparum malaria is accompanied by tropical splenomegaly syndrome. This is another issue. It is due to hyperreaction against البلازموديوم، ودي حاجة بتبقى في طبيعة الإنسان، مش جاية عن طريق البريميونيشن أو الإكسبوجر to infection. Intestinal schistosomiasis can cause splenomegaly secondary to portal hypertension, and it is huge splenomegaly called Egyptian splenomegaly, as we all know. Also, liver fluke infection can cause portal hypertension to the spleen secondary to the portal hypertension occurring in this case. Edema is either generalized edema and ascites present in severe infection with Fasciolopsis bascae due to hypoproteinemia or hypoalbuminemia, hookworm infection due to excessive bleeding and hypoproteinemia first, then it can occur due to heart failure نتيجة الأنيميا. كمان chronic schistosomiasis with hypoalbuminemia can cause swelling of the legs and generalized edema. Diphyllobothriasis can cause generalized edema as a sensitization against the worm. Also, Chagas disease can cause edema due to heart failure. It is of nutritional origin in other cases، يعني بتيجي نتيجة الهايبو. Localized periorbital edema can occur in Chagas disease, the acute Chagas disease, and it is an early or maybe the first sign of Chagas disease, which is Romana sign. Also, ocular sparganosis can cause unilateral periorbital edema. Also, ocular conuriosis, which occurs with conurus in the orbit، بتبقى على السكليرا تقريبا من بره وبتعمل localized edema. The other cause is Luayasis or Lua infection, and in this case we can find the adult in the conjunctiva or on the trunk, on the body trunk. Also, ophthalmomyiasis, which is caused by Estrus ovis, the sheep nasal fly. Periorbital edema with edema of hands and splinter hemorrhages can occur in trichinosis caused by vasculitis around the migrating larvae. Lastly, elephantiasis. Elephantiasis is a hard, non-pitting edema with hyperplasia of connective tissue, thickening and darkening of skin، فبتبقى شكلها عامل زي رجل الفيل مثلا، ودي can be caused by Bancroftian filariasis also Brugian filariasis، ولازم نعرف الديفرنس ما بين الإليفانتيزز في الاتنين، واحدة منهم بتبقى above the knee والتانية below the knee. كمان في الأونكوسيركايسيس لما هيحصل redundancy of the skin and also kinking of lymphatics, this can cause elephantiasis of lower limb. Wish I could collect many important symptoms and clinical signs accompanying parasitic infection. Hope that you all are benefited from this lecture, and goodbye.